Kate Osborne. Thank you, Mrs Miller, and it's a pleasure to serve on today, and thank you to my honourable friend, the member for the City of Durham and the APPG for securing this important debate. I must first announce my interest in this debate as a former smoker. Growing up in the 80s as I did, most if not all of my peer group smoked. I can recall the purchasing of cigarettes at the local sweet shop, which was very happy to accommodate the limited budget of the school children by allowing us to buy our cigarettes individually. I came from a household where there were adult smokers, and for me to take up the habit seemed almost inevitable. I fought a lifelong struggle against smoking and with kicking the habit, and it wasn't until the pregnancy of my first son that I felt able to give up. And although I have returned to it once or twice, I'm pleased to say that I've now not smoked for over a decade. The tobacco industry's excessive profits are built on establishing an addiction in people like me in their teens, whom unfortunately will often not succeed in stopping before it kills them. The Honourable Member for Blaydon spoke about the figures in Gateshead, which is one of my local authorities, and it's estimated that smoking costs my other local authority of South Tyneside around £37.9 million every year through smoking-related health and care needs, lost productivity and premature deaths. And I support the recommendations made by the APPG on smoking and health for a comprehensive strategy that calls for additional regulation and targeted investment with the full engagement of health and care services and a shared mission to end smoking. The communities where smoking is still part of the daily fabric of life need investment to ensure that the support is there, particularly those with high levels of addiction. Services need to be much closer to the people that need them, in social housing, in mental health services, children's centres, within LGBT service settings, wherever the need is greatest, we should have the support available. I agree with the APPG that it's not the taxpayer who should foot the bill for these important services, but highly profitable tobacco companies. Funded is needed now, and we cannot wait. So I ask the Minister, does she agree that the Government should include provision for a smoke-free 2030 fund in the Health and Social Care Bill and bring this measure into force in 2022? Funding and investment into communities with the greatest need is important to help more smokers quit, but we also need to prevent young people from starting. Reducing the availability of tobacco to young people can help to achieve this, and existing laws on age of sale need to be fully enforced. Whilst retailers need a licence to sell alcohol, no such licence is required for the sale of tobacco products. Therefore, enforcement action can be slower, more complex, and ultimately have less impact on retailers that break the law than there would be if a licensing scheme were in place. Data from both YouGov and ASH, who I thank for help with my contribution, show that both retailers and the public support the introduction of a licence for retailers selling tobacco products. Introducing the licence does not need to be costly. The tracking and tracing system is already in place for tobacco retailers. As such, there would be minimum extra burden for retailers and wholesalers to turn it into a public health licensing scheme with little additional administrative cost. At the same time, it would equip local authorities with more effective powers to protect their local communities from those who sell tobacco products to children. Will the Minister commit to establishing a public health licensing scheme for tobacco retailers to make it easier to prevent underage and illicit sales of tobacco to further protect children from taking up smoking? The NHS has committed to support more smokers through the NHS long-term plan, but as with all plans, the proof is in the eating. With all the pressures in the system right now, there is a risk that the rollout is uneven, with smokers who need support missing out. Integrated care systems are responsible for putting in place prevention plans for their populations, and these plans need to meet the needs of smokers and ensure that the commitments in the long-term plan are delivered. So will the Minister ensure that all ICS prevention plans are published and include achieving a smoke-free 2030 as an objective? And finally, I hope the Minister will consider tasking NHS England with establishing an operational plan to support all smokers in primary care and community mental health settings. Thank you.
Now turn to the